Welcome to a special question and answer session with Dr. Rodrigo Rodriguez at BioCare Hospital and Wellness Center in Tijuana, Mexico. I am Lindsay Williams. For a free consultation, you heard me correctly. I know you don't get that in other parts of the world, but for a free consultation with a doctor at BioCare Hospital, call the toll-free number right into the hospital in Tijuana, Mexico, 800-262-0212. And when you call, ask for their 60-page booklet, which will be sent to you free of charge. Dr. Rodriguez, you were a pioneer in stem cell therapy. In fact, stem cell therapy is an art here at BioCare Hospital. And ladies, let me warn you, you have never had a facial until you have had a stem cell facial at BioCare Hospital. It'll work wonders for you, and I know you ladies like to look nice. So Dr. Rodriguez, would you please explain a stem cell therapy and a stem cell facial here at BioCare Hospital and why it is so different than what it is given in most other places?
Well, I'm going to tell you a little story that I'm sure many of you know. We all have heard about bone marrow transplant. What is that? When people have a blood-borne disease like leukemia, many cases, the only tool that doctors will have is to use heavy doses of chemotherapy, destroy all the bone marrow, and then they put a transplant of healthy bone marrow in the body, and starts working again. That brought the attention of physicians to say, how come a group of cells that I took from the body, once the whole tissue is erased, I can bring them back and they're going to be successful and function? That started stem cell therapy. We found out that it was possible to take cells from the body and make them create new cells, new life, new everything. It was believed up to very few years ago, when I was in medical school, for example, we all thought that stem cells are in the womb. Why in the womb? Because when you're creating a new baby, you need a blood vessel here, a heart there, a brain there. You began with only one cell. Remember? Your father and mother created just one cell. How are you going to make bones, liver, heart, everything from one cell? Well, because this cell has the capacity to turn into something, whatever it's needed. And those are called the stem cells, because they're the origin, the common origin of every type of cell. So we thought, well, this is the answer to many of our prayers. And when we started using it, then, of course, like usual, easier said than done, we found different problems that have been step by step solved. But in today's time, I have to tell you that stem cells that you remove from the same patient, because that's the other important finding. We thought that when you were born, stem cell therapy stopped. But now we know that we keep producing stem cells all throughout our life. So what we do is we harvest them. We go to your body, to your own body, we harvest those cells, we concentrate them, we feed them, and we put them back into your body to replace cartilage, or lost bone, or heart condition, or simply energy and well-being. It is absolutely fantastic. And stem cell therapy, as we do it in BioCare, is always autologous. We will always use your own cells. I don't like to play gambles in figuring out if the cell from this person is going to work for you, because I don't want to risk anything. I want to gain everything, not to risk. So using your own cells is the safest way to do stem cell. Number one. We do not do embryonic cells. I'm against it. I don't use them for many reasons. This is not the place to talk about them. But using your very own cells is very easy, because I'm going to harvest them from your body, again, concentrate them, feed them, activate them, put them back in your body, and you will be able to feel the difference. And we use it for immune system boosting, we use it for rejuvenation in general, we use it for the management of chronic heart disease, we use them for a lot of things. It's actually, at the bottom line, is a very simple idea. Technically complicated, but simple idea that works very well. So again, you have questions, you can give us a call, you can write us an email, and we're going to answer you. You have a doctor waiting at the other end of the 800 line to give you a free consultation.